joining as we go.
Absolutely. And we've had some really high numbers of vets watching the webinars afterwards as well, so it'll be good. So I'll just welcome everybody to the second webinar of 2021. We're a few minutes from the lecture starting, but please remember to mute and close your video throughout the lecture. You're just right, Lee. You're just right.
Do I minimize it though, because you're in the way of my...
Am I in the way?
How do I put you to this? I just shift it. Is that right?
Can you click on the box and just drag?
Done.
That's right. Great.
Really with this stuff. There we go.
Lovely.
Right.
So a big warm welcome. I'm Dawn Peacock. Hosting today with me is Dr. Rebecca Waite from Vets in Compassion, and we're also delighted to have Elaine with us as well today, founder of Vets for Compassion. So it's going to be a really great webinar. Annie, who I don't think we can see at the minute, but she's on here already, will be our interpreter for the lecture. So it's a big thanks to Annie for the hard brain work today to sort the languages out for us. So we're really pleased to have our first lecture of the year, and next month we will be back to a tutorial style, just after the first one that we tried in March, which was a huge success. And Beck will be our speaker for that one. So I'm sure at the end of this lecture, she'll give an update on what she's going to be talking about and ask for questions that you might want to bring in preparation. So I'll hand over to Beck, who'll introduce our speaker for today, and we'll move on.
Great, thanks Dawn, and thanks for doing all the organisation for us again for our webinars. We very much appreciate all your work and Annie's, and especially in getting that translation all done. That's wonderful, thank you. So it's my pleasure tonight to introduce a colleague and a good friend of mine, Dr. Lee Williams. Lee has been a vet for almost 40 years now, so has an enormous amount of experience, and for some reason about 15 years ago decided that dermatology was what really excited her. And for the last 15 years has been working more and more in dermatology, and the last 3 years has been working alongside another doctor running a business called Animal Dermatology Canterbury. Would you like to translate now for me, Annie?
Yes, thank you. I'll also translate what Dawn says previously, if that's okay.
Thank you.
大家好，非常感谢，非常欢迎大家能够参加我们今年的第2场的这个线上网课。然后，请大家能够尽量的关闭自己的话筒，还有关闭自己的这个摄像。然后刚才Dawn自己介绍了，然后自己，今天呢，我们同时还有这个 Rebecca 老师，还有我们的依琳老师，这个是兽医关怀无国界的我们的兽医的专家。然后呢，今天今天我们主要是今年主要是第一个的这样一个讲座的一个形式，然后下一个月呢，我们会有一个问答课，然后我们的这个 Rebecca 老师会作为这个问答课的这个老师主讲人，然后课后呢，他也会跟大家提一下这个跟下一节课的一些相关的内容。然后呢，接下来就是Rebecca 老师介绍了一下我们今天的讲师，非常感谢大家能够参加我们的这个网课，然后呢也做了很多前期的工作。然后今天我们的老师呢是那个 Dr. Lee， 他是Rebecca 老师的一个很好的朋友，然后也是一个很好的同事。这个Lee老师已经是做兽医师做了40年了，所以有非常多的经验。然后大概15年以前呢，他对这个皮肤病产生了非常大的兴趣，然后就之后越来越多的看了很多皮肤病的这个病例。然后3年左右的时间呢，他最近3年他开始了这个一个转诊中心，一个这样专门看皮肤病的这样一个服务。
Thanks, Annie. That was a lot. Well done.
Thank you.
And so, as I said, for the last 3 years, Lee has been working more and more in dermatology, and I think now probably 2/3 of your work. Would you say, Lee? Yeah, which is probably my worst nightmare. But I know it does make up a huge amount of what we see in general practice. So I'm hoping that the information she's going to give you tonight is going to be really useful for you back in your own clinics.
然后他因为最近这3年的时间，主要都是在看这个皮肤病的这个转诊，然后也是在这个做这些转诊中心的运营，所以呢，就是他肯定会有很多这个关于皮肤病病例的一些相关的一些资讯。然后我们平时在这个就诊这个皮肤的我们平时看诊的时候的很多一些皮肤病的这种病例，对于老师来说肯定都是比较常见的，所以就是希望对大家会有一些帮助。
So thank you so much for joining us, Lee, and I'll hand over to you.
好，感谢大家。
Hi. My approach here is to present this as a resource for you to have a few pages of information that can give you background knowledge to help you with that skin consultation that comes in and you haven't got very long to sort it out. There's certain questions you should be asking, and you can do it quite quickly, but there are some skills and a bit of knowledge that you need in order to be efficient.
好，大家好，非常感谢大家能够参加今天的网课。然后今天老师给大家的这样的一个讲课的思路呢，主要是就是我们在这个看诊过程当中，我们看诊的时间都是有限的，很多时候可能就15分钟。然后就是在这个15分钟的过程中，我们需要建立起一个这个看诊的思路。然后呢，就是我们自己会需要问自己一些问题。然后在这个问自己的这些问题之前呢，有一些这个知识储备是需要的。然后今天就提供给大家。
So the itchy dog, you need to tell the client that we need to identify the cause of the itch before we can treat it. It's important to...
Sorry. 就是这个犬瘙痒的时候呢，我们非常重要的一点是要告诉这个客户到底是什么原因造成这个狗来有这个出现的瘙痒，这个是非常重要的，一定要识别出是什么原因。
It's important to get a good history. This can be quite snappy or quite fast. You don't need to take long, but you do need to know, is it recurrent? What age did it start? Is it seasonal? Are there gut signs? Have they flea treated? What diet is it on? And just how itchy is it? I will give you an example soon of an itch score that you can use to give people.
在这个过程当中有一个很重要的一个部分呢，就是这个病史调查的这部分。关于病史调查这部分呢，不需要非常非常长的这个时间，非常详尽的这种去调查，但是有一些很重要的一些点是需要问到的。那比如说这个瘙痒的这个症状是这个复发性的呢，还是说是初发的呀？还是说是之前有没有出现过这样的一个症状？然后它这个狗多大的年纪？然后它到底有多痒？然后呢，它这个平时都是吃什么样的饮食？有没有这个跳蚤的这个治疗？然后它这个是不是季节性的？然后有没有胃肠道的症状等等。
Sorry to interrupt, Lee. I might get you to press play on your PowerPoint so that we get the big slides. Can you do that?
Where is that? Sorry.
As if you were presenting in real life.
I think I go to
real life, but you know what I mean.
Is that right?
Yeah, that's it. Do the slideshow. Perfect.
Has that gone to it?
No. If it doesn't work, it doesn't matter. But
just try again on slideshow. It should.
It should.
Yeah, at the top there.
Up.
I'm moving my mouse to help you. I just realised that.
Yeah. So keep going up.
Just straight up
into the red bar.
Right up the top.
And then down.
Because the Zoom thing was over the top of it.
Yeah.
There you go.
So, and then play from current slide. Will that?
Yeah.
There you go. Perfect. Thank you. That's much better. I'll go quiet again now.
Now I have to just shift us out the way. That's it. What I do while I'm getting that history is just examine the whole dog very quickly, just observe distribution and nature of lesions. just use your eyes, do it fast. But I also have got efficient at taking samples at the same time. So this is all in minutes.
好，然后那个老师现在把 PPT 放出来，大家也可以看这个屏幕上的 PPT。然后关于这个刚才在说这个调查病史，在调查病史的这个同时呢，老师也会对这个狗狗进行这个体格检查。然后他检查的过程中呢，就是非常非常迅速的去检查，然后去观察它这个病变它这个分布在什么地方，然后这个病灶的这个性质是一个什么样的性质。然后在检查的时候呢，也可以同时来进行取样，这个其实是非常快的一个过程。然后这个可能1-2分钟就可以搞定。
And then the next thing I do in my mind is list a differential diagnosis, and most fall into 3 categories. You can just keep it that simple. If it's something weird, then it probably is going to not fall in these categories, but most of the time it's either ectoparasites, infection, or it's an allergy. So I just keep EIA in my mind and go through that very quickly.
好，然后哪位医生没有关自己话筒呢？请关闭一下，因为这个会影响我们其他的这个医生的听课。然后在这个老师在这个检查的时候呢，同时会有这个脑海中列一下这个鉴别诊断的这样的一个列表，然后导致瘙痒的这样一个过程，主要的绝大多数的都是有这3类，一个是外寄生虫，一个是感染，一个是过敏。当然也会有些其他的一些比较奇怪的这个病灶，但是就是绝大多数的都是这3个。就是这个 EIA 这3个字母，英文字母。
I just tried to go to the next slide and it's stopping me. So how do I move to the next slide from the big screen? Here we go. That one? Yes.
Got it.
Okay.
No,
so
moved on.
I don't think it's changed, Lee.
It's changed on mine. Which is it gone away from that?
We've got the itchy dog with no picture, just writing.
At the top, onset, yes, same thing.
Is
same
that right?
picture.
Okay.
Yeah, so there's just 1, 2, 3, 4. It's onset, how itchy it is, you know, the distribution and the lesions. And you can see from this example that that it's quite generalized but very ventral, and the lesions, there is some excoriations, mainly erythema, redness, and you know, clearly this dog's itch score is very high.
然后
I don't think that the slides are changing, Lee, because we can still only see the one with the itchy dog with the words on it. I'm not sure if you might have to change back. Dawn, do you think we should change back to the other way?
I'm up to the itch score page now. Is that not there?
No, that's not what we can see.
Sorry. Right. So I need to go to, I don't know how to get out of this now.
Do you press escape to exit full screen? Let's see if that.
Here we go.
There we go.
Yeah, might have to stay there, mightn't we?
Yeah.
This has happened once before too, so no, stay there. That's great. Thank you, Lee. Sorry to keep interrupting.
That's all right. No. So just to recap, you can clearly see from that actual dog that it's a young dog, early age of onset. It's extremely itchy. The distribution is mainly ventral, and the lesions are a mixture of excoriations, redness or erythema, and some papules that are visible. And the distribution, it includes the muzzle and the lip margins.
好，然后这张这个幻灯片上呢，大家可以看到啊，就是这个 狗狗的这个分布呢，绝大多数它是一个在这个腹部的一个病灶的分布。然后呢，这个狗狗是非常年轻的一个狗狗，然后它这个发病的是处于这个比较早的一个发病的一个阶段。然后它的这个病灶的这个表现类型呢，绝大多数是一些什么丘疹啊，然后有一些脱落，然后看起来非常的红，然后它的这个嘴巴或者是它的口鼻部、嘴唇部这些地方，它都有很多的这个有病灶。
I give all of my skin clients this itch score when they come in, and depending on the dog's behaviour, they will tell me what number. And this is how we communicate, especially at revisits, as to just how we're doing in terms of reducing the dog's symptoms of pruritus or itchiness. Now this pruritus visual analog scale, PVAS in English, is available online, and you can just Google it. The Canadian Academy of Veterinary Dermatology, you can just type in itch score dog and it will come up and you can print it off. I give it to every client.
好，然后所有来这个老师诊室就诊的这个狗狗呢，老师都会给他一个这个 PVAS 的这样的一个瘙痒评分的这样的一个表。然后这个表呢，就是在网上是可以找到的，它是一个加拿大兽医学的这个皮肤病这个学会他们制作的一个表，它是根据这个动物的这个行为来进行评分，然后在他们所有的这个就诊啊、复诊啊这些过程中都是用来这个量化，然后就是来评估这个狗狗这个全身瘙痒的这个症状。就是大家也可以上网去找这样的一个评分表，然后之后在这个有瘙痒动物来的时候也可以用。
It's also important to look at unaffected skin. What distribution is not affected? So dogs with environmental allergies, for example, don't get lesions on the dorsum or the back of the dog or under the tail very often, but food allergy dogs do.
进来的医生麻烦关一下话筒啊。然后那个关于这个瘙痒的这部分呢，很重要的一点也是大家可以看一下这个皮肤的病灶的分布。然后有一些这种瘙痒类型呢，它的这个病灶的这个分布是不符合某一些瘙痒类型的。那比如说这个皮肤的这个食物过敏性的这个皮肤反应，它的这个背腹部就比较多的这种出现病灶。然后有些时候呢，就是有一些瘙痒它就只出现于尾巴部、尾背部这些地方。然后这个就可能就不太符合这个皮肤过敏。
For background information here, causes of pruritus, when we're looking at our EIA, remember, ectoparasites, they are a primary cause of itch. And so there is a measure of itch where 1 star is mild, 2 stars is moderate, and 3 stars is severe. So Sarcoptes mites is a papular rash, and it is extremely itchy, and it has a particular distribution. And Demodex is not quite so itchy, and it involves hair follicles. It has a folliculitis. And in West Highland White Terriers, it gives them a greasy back. And then you've got walking dandruff, the Shalletiella, and Otodectes tends to be the ears and face. So distribution can help you with what particular kind of mite or parasite you might have. And there's some examples there with pictures of where to sample on the dog.
Hey, Lee, sorry, Annie, I'll just jump in. I wonder if, should I share your PowerPoint and move through the slides? Because I don't think we're seeing the changes. And I think maybe it's a tech issue that we can't.
This is number 6, and it's a causes pruritus.
Yeah, and we're still on number 3.
Oh,
so
goodness.
Shall I jump into to share instead, and then you can just let me know if I'm going
Sounds
to.
like a good idea, Dawn.
Yeah. Okay. Give me 1 second. Let's see. I'm not sure if I can. Yeah. So if you can stop sharing, and then I'll share.
Oh, yep. Stop share. So I
Brilliant.
just put that at the top.
Yep. That's it. And then
Okay.
let me pick the right one. Let's have a look. Does that look right?
Yes. Yep.
And I'll try. Now let's check that I'm on the right one. So is this right, number 6?
Yes.
Yeah. Okay. So I'll mute, but yeah, just let me know if you just say next slide, and then I'll swap over.
Fine.
Okay.
Well, I think she had to.
Yes. Yeah. Annie, should we wait for you to translate?
Yeah.
Yes, I'll translate. I have taken notes, so it's okay.
Thank you.
就是刚才在说我们这个关于这个病灶的分布，然后有一些比较独特的一些病灶分布是很有帮助的。然后在做诊断的时候呢，我们在这个就是这个瘙痒的这个程度，然后也是非常有帮助的。然后就是像我们刚才说这个一个是 ectoparasite， 就是 E 这个部分就体外寄生虫，一个是 I 一个感染。然后还有一个是 A 是这个过敏，它们这个是主要的导致瘙痒的一些原因。然后像是这个螨虫，就是我们的这个疥螨，是非常非常瘙痒的一个病原体。然后呢，像是这个蠕形螨呢，它的这个瘙痒的评分呢就稍微的不那么痒一些。然后像是这个西高地的白梗，它的这个背部经常都会很油腻。然后有些时候像这个桀骜螨。然后这个它会就是也叫行走的皮屑，然后它主要是在这个某一些地方，然后在这个耳螨呢嘛，比如说这个耳部、面部更多的这个分布会多一些。然后所以就是我们像采样的时候，比如说桀骜螨，它采样在背部，然后这个蠕形螨的话，我可能就是找一些黑头的部分一些毛囊柱形的地方去采样。
Next one, I guess. So the next cause of pruritus, infection, is a secondary cause, and usually there's underlying skin disease, often allergic, but not always. But infection will be a secondary problem, and it will certainly be making the dog itchy. And Malassezia yeast infection is far more itchy than bacterial.
下一个刚才讲了这个体外寄生虫，那下一个呢，我们就讲一下关于感染的这部分。很多数的这个皮肤病的这个感染，它都是这个继发感染出现的。然后绝大多数的感染呢，一个是一个细菌性的，一个是这个马拉色菌的这样的感染。然后马拉色菌的这个感染所造成的这样的一个瘙痒程度呢，会大大的远于这个细菌性的瘙痒。
And the next one. And then the next one is allergies, of course, and this is more common than ectoparasites or infection. And there is 2 main ones, canine atopic dermatitis, and you'll get redness first, hair loss, scaling, crusting, excess pigment, excoriations. Tends to be ears, face, feet, axillae, inguinal, eyes get involved. Sometimes they're rhinitis, or sneezing, and they will get otitis externa.
好，我们先来讲，接下来呢讲一下这个过敏。过敏的这个出现皮肤病的这个症状呢，其实要比这个，在老师的经验当中啊，这其实是要比他们那边的这个体外寄生虫感染和皮肤感染这样的这个几率是要高的。然后在这个过敏这方面呢，它有2个比较重要的这个2大类，一类呢就是这个犬的异位性皮炎， 另外一个呢就是这个皮肤的对于食物的一些不良反应。然后在这个犬异位性皮炎这部分呢，首先这个症状是先会起一些红斑，然后会有这个脱毛啊、淋血，然后结痂、色素沉着、剥落、脓创性的皮炎。然后它的这个分布主要是在这个耳廓、面部、足部、腋窝部分、腹股沟部分，有些时候眼睛也会受一些影响。然后它会有一些这个鼻炎，比如说这狗会打喷嚏，然后或者是外耳炎等等这样的症状。
The other very common allergy, not as common as atopy, but just as important, it can be very severe and it is actually itchier, and that is cutaneous adverse food reaction or food allergy. It tends to be papular first, so you'll get lesions, erythema, urticaria, hair loss, scaling, crusting. So they can look very similar. It can involve the ears, face, feet, the axillae, inguinal, but it also tends to involve the perineal and perianal areas. Can get itchiness there, erythema or actual dermatitis, otitis externa. There'll be some gut signs sometimes, not always. And you will get anal gland issues with some dogs as part of the food allergy complex.
然后另外的一个比较大类的这个过敏症状呢，就是对于这些食物产生的过敏，然后这个其实是非常痒的，当然这个异位性皮炎也很痒，但是这个食物的不良反应呢会更痒一些，然后它的症状是有一些区别的，这个病灶的分布也是有区别的。在这个食物过敏这一部分呢，它首先起的是这个丘疹。然后会有一些红斑，然后这个荨麻疹的这种症状，脱毛、鳞屑、结痂、色素沉着、脓创性皮炎这些都会有。然后但是大家可以相互对比一下，这个异位性皮炎它是先起了红斑，然后它的分布部分呢，主要是在这个耳面部，然后会有足部、耳廓、腋窝、腹股沟。但是它涉及的时候呢，它还会涉及到会阴部分或者肛周，然后它同时也会有外耳炎，然后同时也会有消化道的一些症状，然后也会有肛门腺的症状。
And next slide. And next on the list of allergies is flea allergy dermatitis. And for cats, we call that flea hypersensitivity. You'll get a lot more chewing and nibbling. We call it corn cobbing. They kind of nibble away at the skin more than you get licking. You'll get papules, erythema, plaques, hot spots on cheeks, flanks, rump. It will affect the back, the dorsolumbosacral area, tail base, cordiomedial thighs, and the ventrum. So the distribution is a little bit more dorsal.
好，接下来的一个这个过敏反应呢，是这个跳蚤过敏的这样的一个皮炎。然后在这个猫的这个当中呢，它们大多数会叫这个跳蚤引起的超敏反应。然后在这个跳蚤引起的这部分的过敏反应皮炎呢，这个动物它会很多的出现这种啃咬，它会去拿它们自己的嘴巴和牙齿去咬它的这个皮肤，而不是说是单纯的去舔。然后它出现的一些症状呢，会有一些丘疹啊、红斑，然后斑块，然后在这个脸颊、腹部、臀部都会有一些热斑，然后在这个背部的腰指部这些地方，会有一些病灶。稍后这个病灶出现的部分，大多数会在这个背部这部分。
Acute and chronic flea allergy lesions can be differentiated on cytology, but that's getting a bit technical already. Can go back to that. The next kind is where you get genuine insect bite hypersensitivity, and that can result in eosinophilic furunculosis, severe inflammation. Tends to be around the eyes, around the nasal bridge and the ear margins. And the more unusual, quite rare in dogs actually, is true contact allergy, but it's papular and areas of contact only. and sometimes atopic dogs will be prone to it, but it is just underneath exactly where they contact the antigen.
好，再多说一下关于这个跳蚤过敏性皮炎，它的这个急性和慢性呢，会有一些这个症状上的区别。然后我们在做这个细胞学检查的时候，会发现会有一些就可以进行鉴别的诊断。我们之后会再多说一些细胞学的内容。然后接下来的一些过敏反应呢，一个是这个昆虫的叮咬出现的这个超敏反应，它主要出现的是在这个眼周部分，然后会出现一个比较严重的一些发炎，然后它的在这个鼻子的这些周围，然后包括这个耳缘部分会非常的多。然后另外一部分呢，就是这个接触性的过敏，然后这个接触性的过敏在这个犬当中是非常少见的，然后它仅仅是出现在这个接触部位，它可能会与这个异位性皮炎是并存。
And the next slide. So typical allergic dermatitis. This is a West Highland White Terrier on the left, which is a very young dog. That dog was only 5 months of age. It was severely, severely atopic. And then you've got a contact allergy up the top there, where you've got papular lesions that are almost welt-like, and just typical lesions affecting the feet and the inguinal areas. And there's your kind of ventral line of alopecia in that Westie. That's quite typical of allergic skin disease.
好，大家我们看一下几个病例啊，像左边的这个狗狗，这个是非常严重的这个异位性皮炎，然后这个狗狗它其实是非常年轻的一个狗狗，才5岁大，是一个细高地白梗，然后大家可以对比一下右边的这些病灶的这个出现，像是中间上方这个呢，它是这个接触性皮炎的这样的一个过敏，接触性过敏性皮炎，然后它这个病灶主要表现的是这种丘疹性的，然后像是这个脚，它的这个狗狗的这个爪部，然后经常出现病灶的一个部分，然后会有一些脱毛啊，然后这个包括腹股沟这些部分，然后大多数的病灶都是出现在这个腹侧。
Now the next slide. So the other things besides EIA, your ectoparasites, your infections, or your allergic skin disease, are other things all of which will look unusual. And there's some examples here of the weird and wonderful. But as you can see, if that walked into your consult room, you'd go, well, that's unusual. And often they're immune mediated or involving neoplasia.
然后刚才说了，我们这个最主要的、最多数的这些瘙痒原因呢，一个是体外寄生虫，一个是感染，另外一个呢就是这个过敏。除去这些之外呢，还有一个就是其他部分的这些导致皮肤症状的这些病原病因。然后所有的这些皮肤症状，这些其他部分呢，它看起来都会非常的不正常。然后大家看到这些的部分都会有这种反应，觉得哇，这个看起来非常不正常。然后绝大多数这种情况下呢，都是会和这个免疫介导或者是跟肿瘤这些是相关的。
Next one. Okay, so for number 4 is where your diagnostic plan, the EIA, for chronic pruritus, you rule out ectoparasites, you rule out infection, you rule out flea in food, and what you're left with usually is canine atopic disease. So it's a lot in one sentence, but basically it's a straightforward diagnostic plan, and it may take several visits.
好， 我们在这个慢性瘙痒的过程当中，我们排除了体外寄生虫感染，排除了感染细菌或者马拉色感染，排除了这些跳蚤或者是排除了食物过敏等等这些过敏这些原因之外，剩下的这些瘙痒呢，通常都是这个犬的异位性皮炎这样的一个诊断。然后在这个异位性皮炎的诊断呢，其实是属于一个比较直接的一个诊断。我们在这个有可能会需要多来几次医院来进行诊断，然后在排除所有这些之后，那基本上就是异位性皮炎了。
We know now that canine atopic disease, or CAD, is polygenetic. It's not just one gene involved, it's multiple genes affecting different things. But simply, skin barrier defects allow the contact of environmental and possibly microbial allergens with epidermal immune cells, which then results in localized hypersensitivity reactions.
这个犬的异位性皮炎呢，是一个多基因的一个多基因因素的一个疾病，它是这个皮肤的屏障出现有一些缺陷，然后就使得这个环境中一些过敏源，那有些时候这些过敏源可能是微生物就与表皮的这些免疫细胞进行接触，然后就导致就出现这个局部的超敏反应。
Canine atopic disease requires ongoing, individualized, multimodal treatment and management. Not one size fits all. You have to find a plan for that individual animal.
然后这个异位性皮炎呢，是需要持续性的进行这个个体化的多模式的治疗和管理。那不是说是有一个什么神奇的药方，然后所有的一个药方所有动物都可以用，不是这样的。大家一定要针对很个体的这样的一个动物去进行异位性皮炎的这样的一个诊断的计划。
At our referral practice, we do intradermal allergy testing on our atopics. So that becomes part of the toolkit to help us diagnose what is causing the reactions, and we provide allergen-specific immunotherapy to help desensitize them. So that is something that we're able to do in a referral practice. The unusual other skin diseases that I showed you those horrible photographs before, the ones that are itchy will require biopsy, but best once you've got secondary infection treated. So don't biopsy right away. But if the animal is very, very unwell, the condition is peracute and severe, then biopsy may have to be a more urgent thing.
好，那我们刚才说了这个异位性皮炎呢是需要进行个体化的这个治疗计划。然后在老师的这样的一个诊所呢，他们这个转诊医院的诊所，他们会对这个异位性皮炎这个狗做这个皮试，来找出它这个导致它瘙痒、导致它皮肤症状的这些病原体，然后再根据它的这个个体的病原这个不同的这些导致瘙痒的这些病原体呢，来提供这个特异性的这个过敏原的免疫疗法。然后像是其他的这种很不寻常的一些皮肤病呢，它是需要进行活检的。然后在这个活检的时候，不要说来了一个病例，然后就立即就去活检。它如果是这个皮肤病是有继发感染的话，是需要先去进行治疗的。但是如果这个狗狗它这个瘙痒非常的严重，然后动物看起来非常的状态不好，而且这个是一个亚急性的一个症状，那可以就进行活检。
Oh, next one. So the short-term plan is to rule out mites, to control fleas, and to get rid of all microbial infections, and maybe an elimination diet trial. And that can actually happen before they leave your consult room. So your diagnostic tests, flea comb, just comb them, see if you see any flea feces. scrapings, we don't scrape much anymore, but we just squeeze and use sellotape because of very good treatments for mites now. The mites are hard to find but easy to treat, so not so much in the way of scrapings, but if we do them, we just squeeze hard and use sellotape. And the next thing is cytology, and I can't emphasize it enough. It is the magic tool. Cytology, cytology, cytology. Look at samples taken from under crusts, from ulcers, from normal skin, from pigmented areas, from greasy areas. Just get plenty of tape, smears. You can take scrapings from under nail beds. Just put them on a slide and stain and do cytology. Use your microscope.
好，然后我们可以做一个短期的这样的一个治疗方案。那首先是要排除这个螨虫，治疗跳蚤，消除所有的这个微生物的感染，有可能会需要进行这个食物排查实验。那就是这个短期的这样的一个计划其实是非常快的。那可能这个狗狗还没有完全结束这个会诊，就可以进行完全就做完这些以上的这几个部分。然后在这个排除这个跳蚤的这个部分呢，大家可以去做可以投资一个这个跳蚤梳，就去拿这个小梳子去梳这个狗狗的毛，看看有没有这个跳蚤的粪便能够掉下来。然后呢可以做这个刮片。那现在呢他们基本上都不做这个不用刀去刮了，而是就是使劲的把这个皮肤给它挤起来，然后再去用这个胶带去把它去粘这个样本。然后老师强调就是重要的事情说3遍，所以在这个课程上写了很多遍，就是这个细胞学，大家一定要去做这个细胞学的检查，是非常重要的。那很多的这些病灶，然后各种各样奇奇怪怪的这种病灶，什么丘疹样的呀，什么各种潮湿部位啊、油腻的地方啊，这都可以做这个细胞学检查的。然后其实也不需要用用这个盖玻片，就直接用这个胶带去粘，然后这个染色，然后这个就可以用这个显微镜去进行检查。
And we're sampling the skin, of course, but don't forget about the ears. Even if the client hasn't indicated that they're an issue, always check the ears. Tapes are my favourite. Everyone is different, but I do prefer tapes. They're fast. You don't need a cover slip. You just pour on the blue stain. It's the third stain in the third stage of the diff quick. You pour it on, put pressure on with a paper towel to soak up the excess stain, and then just stick the tape to the slide, and then you can read it right away. Impression smears, that's just putting a slide straight onto a moist lesion. You can use a swab, a long swab for awkward places like ears. You can do a fine needle aspirate of nodules or of cysts or furuncles, and just put that onto a slide and do your 3-step diff quick staining.
好。我们刚才在强调了这个要做这个细胞学的检查，那当然我们这个皮肤上的病灶我们是要去采样的，然后大家一定不要忘记在采样的过程中也要去采这个耳朵的这样的一个样本，就是老师非常强调，就是我们不要忘记去同时也去采样耳朵。然后在这个对于老师来说他最喜欢的就是用这个胶带，因为它不需要这个盖玻片，非常的快，就直接就把这个3号页，就是 Diff Quick 的第3号页就给它倒上，然后呢就把这个多余的纸巾吸掉这个多余的拿纸巾去吸掉多余的染液，然后就把它粘在这个载玻片上就可以去看了。那也可以有一些其他的一些采样的方法，那比如说拿一个干净的这个载玻片去按压它的这个潮湿的这种病变的病灶部位，或者是呢就是有一些比较不太好采样的地方，比如说耳朵，那可以用这个棉签去给它进行采样。然后也可以就是用这个细针抽吸，拿一个注射器去抽它的这些什么结节呀、囊肿啊这些创啊这些地方，然后去做这个Diff Quick的3步染色。
And I tend to score the number of microbes or inflammatory cells. Now, these are just individualized systems. There's no set way of doing it. It's a way of of telling yourself in your notes just how many bugs were there. So 4+ means easy to find on low power. You can see them in the distance. Or 1+ is where you're just finding the odd ones on very high power. So just set up your own system.
好，然后老师在这个进行细胞学检查的时候呢，他倾向于给他这个所看到的这些微生物和炎症细胞进行一个评分。然后至于这个评分呢，当然会有一些不同的这个标准啊。其实大家也可以自己建立一个比较适合自己的这样的一个标准，因为它的主观性还蛮强的。那就是对于老师来说，他进行评分的时候，他会评个1分和1个加号或者是4个加号。那比如说4个加号的话呢，那就是说在这个整个视野里面都会看到非常非常多的这样的一个炎症细胞或者非常多的这个微生物细胞。那1个加号呢，可能就是比如说偶尔会看到一些1个2个这样的一个微生物。
Next slide. Okay, so we'll digress now to cytology. This is the system that I have set up wherever I work, and don't dip slides is all I can say. I advocate sluice bottles where you've got your methanol, your first and second stains in large volume bottles that you can just sluice the slide with. It uses more stain, but if you get good at it, you can charge properly for your skill.
好，然后就是我们来说一下这个细胞学检查的这个部分，大家可以看一下老师照的一个照片，然后就是在这个他不论在哪个地方工作，大家他都是有这样的一个系统，然后大家可以看到啊，他是直接用这样的一个大瓶子去挤出来，把这个染液挤到这个玻片上，他是不会拿这个玻片去去到染液里面去蘸的这样的一个过程。那虽然说有可能就是感觉有可能会这个染液会浪费一些，但是如果大家做得好的话，那其实可以就是通过合理的收费，然后把这个差价这部分给它赚回来。
Just to add that now that we're more conscious of not washing toxic stains down into our waterways, we now have a large water sluice bottle, and we wash over cat litter, and that container of cat litter sitting on the bench will last us about 2 or 3 weeks, and then it's disposed of with our clinical waste.
然后呢，就是老师再多说一下，提醒一下大家，就是他们的诊所呢，现在他们不会直接把这个有毒有害的这些染液呢，直接就洗到下水道里面。他们是怎么做的呢？他们就是会拿一个这个猫砂盆，然后里面放上猫砂，然后就在这个猫砂的这个上面，然后来进行这个染液的清洗。然后就是这个猫砂盆的这些东西呢，可以就是存到2、3个星期，然后就把所有的这些东西和这个 medical 就是和这个医疗废物，然后一起进行回收处理。
This microscope looks very fancy. It's actually not. It's an ordinary microscope with a screen on the top that has a camera. So that is a very good teaching tool that I use. But otherwise, the dermatology station is very basic. It's just sellotape, slides, a few swabs and the stains, and basically I just use the 10 times and the 100 times. I don't even stop halfway in between.
好，然后就是大家看右边的这个台子，然后感觉好像是一个很高端的显微镜，其实它只是一个很普通的显微镜，上面接了一个这个显示屏，这样对于老师来说是一个很好的一个教学的工具。然后就是对于其他的一些需要的一些部分呢，主要是一些胶带，然后一些这个采样的一些棉签，然后有一些载玻片等等的，然后这些就是很基础的这些很基础的东西就可以完成这个皮肤病学的这个诊疗。
Next slide. Okay, what to look at. If you're not accustomed to cytology, it can be a weird world down there. But you're looking basically at keratinocytes, or just the surface epithelial cells. You're looking for inflammatory cells and for microbes. So you might home in on that area there that you can sort of see that there is some inflammation in the distance, and then that's on 10 times, and then I just go straight in, and you can see on a much closer view there that you've got some smushed up inflammatory cells, but definitely there's yeast and some microbes around.
好，那我们在这个做细胞学的时候要看什么呢？主要的一些部分其实是找它的这个角质细胞，就是我们这个皮肤最表层的这个细胞，然后有一些炎症细胞，或者是找这个微生物。那我们在10倍的镜下可以先看有没有一个大概的一个情况，有一个主观印象，然后去把这个放大，然后就可以看这个大家可以看这个右边放大的这个图，那主要是一些这个挤在一起的这个炎症细胞，然后还有一些就是这个酵母菌。
Next slide. Okay. This is the same slide basically on 100 times. So I went right in to that bunch of inflammatory cells, and you can see that there is nucleated epithelial cells in there too, which you wouldn't expect to see on the surface of the skin. So it tells me that there's a high surface cell turnover, and that is typical of allergy. But you can also see close up just how many yeast there are. It's really quite infected with Malassezia.
然后呢，刚才我们说的刚才那部分的这个炎症细胞呢，老师再给它放大去看，然后就放大100倍，大家就可以看到，在这些炎症细胞里面有比较明显的这个有核的上皮细胞，在这个表层的这个皮肤当中是不会出现这个有核上皮细胞的。那这样这个出现有核的这个上皮细胞呢，说明它这个细胞是出现很大的一些转化，是一个很典型的一个过敏症状。那大家也可以看到有很多的这个酵母菌，所以这个是比较严重的这个马拉色菌的感染。
Next slide. Okay, so looking at hair and follicles, inflamed or reacting hair follicles have a lot of keratin around the base, and they are far more cellular. They stain up very, very blue. So you can look at them closely on 100 times for inflammatory cells and microbes. So you start off on the left at low power, and you can see those areas where a lot of cells and keratin has come out when the hair has been plucked by the tape, and then you hone in on the very cells that are around the base of that hair follicle.
好，我们接下来呢可以看就是这个动物的毛发和它的毛囊部分。在这个动物它这个有炎症反应中的这些毛囊呢，它会出现非常多的这个角蛋白，而且可以看到很多的这些细胞。那这些部分在染色以后就会显得非常的蓝。那我们在100倍下去仔细的去观察，就可以看到很多的炎性细胞和微生物。那大家可以看到左边这个毛发用这个胶带粘出来以后，有很多这些角质细胞角蛋白细胞这些东西就被粘出来，然后右边就放大就去看，就可以看到蛮多的这个蓝染的部分。
And the next slide. Okay, so this is pictorial. Thank you, Royal Canin. I use this for teaching my clients all the time, but you can see this is the epidermis of healthy skin on the left, and where you've got squames on the surface joined together with that complicated set of lipids. And then you can see that the epithelial cells at the bottom they become the ones on the top. So you've got this slow change from bottom to top. But with non-lesional skin in an atopic animal, the lipids are altered, and you've got a lot of a higher turnover. Things change, and of course, right on the over on the right, you've got the lesional skin. It's just a nice pictorial of that epidermal layer. It's a handy one to have.
好，在这一张幻灯片上呢，大家可以看到是这个皇家公司所做的这个教学的这样的一个图卡，这是非常好的一个教学材料。那老师呢也会用这些图卡去教育他的客户。那在这张图上呢，它这个是有连接着有这个3部分的这样的一个异位性皮炎的这个不同部分的这个组织结构。那这个正常的这样的一个皮肤，它会有一个脂质层，然后会有一个这个表皮层，会有这个上皮细胞层，然后上皮细胞层它再往上移行，然后变成角质层，然后这个是非病变的部分，大家也可以看到。然后在这个中间有一些这个病变部分呢，大家就可以看到这个脂质呢，它就是出现一些变化了，它就不在它这个正常该待的地方了。然后再往右边呢，就是一个病灶类的这样的一个有问题的这样的一个皮肤，就是老师会用这样的一个图卡去进行这个客户教育。
Next slide. Just a pictorial of inflammatory cells. I'm sure that you're aware of these, but it doesn't help to be. It doesn't do any harm to be reminded. But it's important to be able to pick out neutrophils in particular. Lymphocytes tend to come in with more unusual skin conditions. Eosinophils with allergy, particularly with cats. But anyway, just a pictorial.
好，接下来呢，我们就是可以回顾一下炎症细胞的一些种类。当然，就是大家可能也都会比较熟悉，但是就是可以再回顾一下。在这个我们在做细胞学检查的时候，很多会出现这个嗜中性粒细胞，然后呢，淋巴细胞会出现的比较少一些。然后嗜酸性粒细胞在这个过敏反应，特别是在猫的过敏反应当中，会比较多的常见。
Next slide. Okay, so there's just an example of seeing eosinophils. It's not very clear, but you can see the granules, the pink granules of those eosinophils on 100 times. Easy to spot.
好，这一张图片呢，大家可以看到这个嗜酸性粒细胞在这个样本当中，那可能看的不是太清楚，但是就是大家是可以看到这个粉红色红染的这些颗粒部分这些其实就是嗜酸性粒细胞。
Next slide. Okay, so this type of inflammation is more typical of, well, it's severe, obviously, often autoimmune or immune mediated, but it can also be with very peracute contact reactions. You'll get acantholytic keratinocytes. They're large and they're rounded up with blue cytoplasm, and they're not diagnostic for immune mediated, but they do indicate it.
好，然后在这一张图片当中呢，大家可以看到的是，大多是出现在这个自身免疫或者是免疫介导性这样的一个疾病，然后有些时候这个就是亚急性的这样的一个接触性皮炎也会出现这个叫做皮肤的极层松解这个角质细胞，那这些细胞呢就会变大变圆，它的胞质是呈蓝色，大家可以看到一个蓝染的部分，然后它大多数呢都是会出现这个比较严重的这样的一个症状。然后大多数都是只是这个免疫介导，这个不是最终的一个诊断，不是说看到这个就一定是免疫介导，但是这个的确是一个提示。
Next slide. Okay, so this is just the shape of the microorganisms. Yeasts are little pear-shaped, cocci are round and very, very regular. And of course rods, so just just a pictorial.
好，那这个呢就是一个图表，给大家提示一下关于这个不同类型的图表的这个显微镜下观察的时候形态学的变化。像左边这个酵母菌呢，它看起来像是个梨形的这样的一个状态，然后球菌呢大多都比较圆，比较均匀，然后还有这个杆菌，当然跟这个酵母和球菌是不一样的。
Next slide. Okay, so there's cocci, so it gives you an idea of their size compared to red blood cells and to epithelial and inflammatory cells. And then you've got on the right there, on 100 times, you've got intracellular cocci. They're actually within neutrophils.
好，那我们在这张图片呢，这个是球菌，大家可以对比一下这个图片上球菌的大小和这个红细胞大小，或者是炎性细胞大小，这个对比。那这个和这个表皮细胞、炎症细胞都是不一样的大小。那右边这个呢，这个是细胞内的这个球菌，那就是在这个炎症细胞里面出现了这个球菌。
Next slide. This little character is one that I'm seeing more and more of that's complicating infections. And it used to be called Duplococcus and was part of the strep family. It's been renamed Enterococcus, and it's an oral or fecal contaminant, and it's shared by humans and animals, lives in the gut. It is multi-drug resistant, and but in New Zealand it is still beta-lactam sensitive. I'm not sure about overseas, but just to be aware of it, because it looks like two cocci and actually it's one organism with a line down the middle, and it's bigger than cocci, and I have to bring in amoxicillin into my antibiotic regimes where I see this, otherwise we select for it.
好，那关于这个图片上的这个病原呢，叫做长球菌。那原来呢，它是叫做一个双球菌，这个是一个比较复杂的一个病例。那它属于一个链球菌的这样的一个家族，然后是一个粪口途径感染的。然后和在动物中、在人中都会出现这样的一个病原体。现在呢是不叫双球菌了，叫做长球菌。大家可以看到这两个球，然后以为说是两个病原，其实这是两个球是一个病原，它只说中间是一个有一层膜。然后呢，这个病原它是很多重耐药型的，它是有这个多重耐药的这样的一个特性。那我们在新西兰治疗的时候，老师他看到这样的一个病原的时候，他都是需要用这个阿莫西林去进行这个抗生素的这样的一个治疗。当然就是国外的一些情况，老师不是太清楚，大家临床上可以多注意一下，看一下哪一个的这个药物的效果会比较好一些。
Next slide. Okay, so here's your rods. Not quite focused, sorry. They're soil, oral, or fecal contaminants. You can see nuclear streaming if you're wondering what that is. That's just from the nuclei of inflammatory cells that's been smeared from neutrophils, but there is a slide covered in rods.
好，在这个图片上呢，大家有可能看的不是特别清楚，但是就是勉强可以看到，就是有一些很多的一个杆菌，这个是土壤或者说这个粪口这个途径这些污染物。那这些蓝色的这种丝状部分呢，这个是炎症细胞在这个抹片过程当中破裂了，然后就出现了这个细胞的内容物。就是其他的这些部分就是它的这个微生物。
Next slide. Now, Cytology, quite a large striped organism. It's non-pathogenic bacteria. It's a contaminant from licking. So if you're wondering what that is, it just comes from the mouth, and it's not involved in skin disease, but it can be helpful in showing an owner that yes, the animal is being licked if they don't think that it is. That's quite handy with cats.
好，然后这张图片呢，这个是西蒙斯菌属，然后这个病原呢，它在显微镜下看起来是一种大条纹的这样的一个细菌，然后它是一个非致病性的一个细菌，它主要是来自于这个动物的这个舔的过程中就出现了这样的一个病原体，然后就是可以用这些图片呢去跟这个主人去介绍，然后这个普及一些科普知识这一类的。
Next slide. Of course, Malassezia Yeast. That's an obvious one. often very purple.
好，然后这个马拉色菌的这个感染呢，大多数都是这种紫色的，然后大家也比较熟悉。
Next slide. Now, fungi. Once you start finding them, you will find them a lot. It's worth looking. I very rarely do fungal culture unless to prove cure, because they're easy to find, I find. So a hair that is infected by fungi will be much wider and have a loss of architecture compared to a normal hair on the slide. And then fungal spores are often in hair follicles. So when you've plucked hairs out, even with your sellotape, you look at the hair follicles for fungal spores. And over on the left, there is fairly obvious fungal hyphae.
好，然后说一下这个真菌这部分。那真菌呢，在这个检查的时候其实是非常常见的。那只要我们知道这个怎么样去看真菌，基本上很多的这些采样都是可以看到有真菌的这样的一个感染。然后有这个真菌感染的毛发呢，它这个结构是比较宽的，然后结构就是比较被破坏的这样的一个感觉。然后它的这个真菌的孢子呢，大多数都是处在这个毛囊的这样的一个毛囊的当中。那就是我们在这个甚至于拿这个胶带去采样，然后我们去看到这个毛囊，就可以去看它有没有真菌的孢子。那左边这个呢，就是这个菌丝，也还是蛮明显的。
And then the next slide. Now, just as important is what not to look at, and often this will speed you up. As soon as you know what to ignore and what to hone in on, the faster you'll get through your cytology samples. This is a mixture here of pollens, mold spores. There's trichophyton there off to the left in small amounts, and just proteinaceous debris.
好，我们在细胞学的刚才说了哪些要看的，那接下来就说一些不要去看的，有哪些是不需要看的。要知道这些之后，也就可以加快我们这个诊疗的速度。那在这个图片中是一个这个混合的这样的一个图片，这些混合了一些花粉呢，然后霉菌的这些孢子、毛旋菌属，然后左边这个很少量的有一点，然后或者是大多数都是这个蛋白样的碎屑。
Next slide. So spores, fungal and mold spores, there's Alternaria up there on the left. Crystals, if they've been putting ointment on or there is a residual wash left on the animal, you will see crystals. You can pretty much ignore those. And just sometimes particularly with tapes, because you're not washing them at all, you will have stain precipitate everywhere. So you have to know to ignore the blue stain.
好，那这个真菌孢子呢也是非常常见，有一些这个 环境中的真菌孢子，那比如说这个链革孢菌属的，链革孢属，链革霉菌孢属，或者是这个德氏霉菌，大家可以看它的这个形状，然后有一些是这个结晶部分，那有一些是这个胆固醇然后什么淀粉类的，那有些时候比如说这个动物用了一些药剂，然后或者说是用了一些这个抹在皮肤上的，或者是这个可以留在身上的这种洗剂，那有些时候也可以看到有些结晶，然后有些时候像是这个用胶带，经常都会有这个染色性的沉淀，那因为不会用水去洗它，那大家也要学会分辨，那有些时候是这个染色剂的沉淀，也可以直接忽略它。
Next slide. And melanin granules. Every melanocyte feeds about 20 keratinocytes on the surface of the skin with melanin pigment. And if you've got disruption of the skin surface, you will have melanin granules released, and they're sort of over everything. They just spread around, and they can be mistaken for bacteria, but they tend to be less regular, and they don't stain blue. They tend to be brown, or sometimes they'll take up the pink stain, but they're very rarely blue. And cocci are bigger often than the granules.
然后我们说一下这个黑色素颗粒，那我们在这个采样的过程中呢，就经常会有这个皮肤的这个表层细胞会有破裂，然后基本上20个细胞当中都会有这个至少会有1个细胞会有这个黑色素的部分。那这个黑色素颗粒它破裂以后呢，被释放出来，它就和细菌是不一样的，它是大多数都是这个不规则的。是这种棕色或者是这个粉红色的，不是蓝色的。那球菌的这部分呢，它会更大一些。那黑色素颗粒它就是到处都是，因为它到处都被撒的到处都是那种感觉。
Next slide. Yes. So in the at the end of your skin consult, when you're just about to send them out and give them their medication, and they say, can you just look at his ears? And of course it's important, I'm just reiterating, it's important that they should be checked as part of the original examination. Next slide.
经常很多时候客户都快结束会诊了，然后他说，哎，可不可以帮忙也看一下耳朵？然后一看耳朵就是这样的一个状况，所以就是老师就再一次跟大家强调，我们在采样皮肤的过程中，也不要忘记同时去采样去检查他的这个耳朵。
And next slide. So this is just a good pictorial. It's very useful for showing clients. Thanks again to Royal Canin. Just to show that, the narrowing of the canal, that you've got an eardrum there, but you tend not to have when you've got infections that are complicated by rods. It's a nice one to show that the ear canal is like a funnel for the atopics. It kind of collects the environmental allergens, and you get inflammation down in the canal. Just a useful pictorial.
好，在这里呢，又是另外一个比较有用的一个图卡，也是感谢皇家公司所做的这些教育的材料。那这个部分呢，主要内容就是说，因为这个环境中的一些过敏源等等这些部分，然后就堆积在这个耳道当中，然后导致它这个耳道它有这些增生，然后会有些时候会有一些这个钙化呀、鼓膜改变等等的这些出现。那这个耳道的，大家就可以拿这个东西去给顾客看，就说，哎，你看这个像一个这个漏斗一样的，就把所有的这些杆菌也好，其他这些病原微生物也好，就搜集起来了，然后就导致它这个耳朵出现病变。
And the next slide. Okay, so this is the ear, not that particular ear, but this is ear cytology on 4 times, and then in a bit closer on 10 times. So you can see from a distance that it looks busy, and then you start to hone in on the cells and looking for microbes. Next slide.
好，刚才那一张图片呢是就关于这个有一些酵母菌性的一些耳炎，然后大家可以左边是这个看到有一些很多的一些变化，然后右边去放大去看，然后发现有很多这个酵母菌。
And these are just slides of worse ear infections. The biofilm is staining up quite pink there, and the biofilm is produced by the bacteria, and then you've got on the left a mixed population, and on the right it's mainly rods.
好，在这张图片呢，就可以看到一个这个当然是更严重的这样的一个感染，然后导致的这样去采样了以后，就发现这个这些细菌都已经产生这个生物膜了，或者说生物被膜。它左边呢很多这个是球菌，然后右边主要是这个杆菌。它这个生物膜它染色以后呢，大多数出现这样一个粉红色的这样一个状态。
Next slide.
Thanks. I'll just move it on, Dr. Lee. I'm just looking at the time, and I think if we maybe have another 5 minutes of presentation, that'll leave us about 10 minutes to have some questions or things like that, just in case. I'm not sure if you want to skip forward a little bit. I realise we could probably have another...
I think probably the cytology is the most important bit.
Okay. Yeah, sure.
I don't know if there's much more there, but it is...
That's fine.
Probably the best learning curve.
Sure. So yeah, just so next slide for now, and then
so this is important for the ear.
Sure.
Because if there's mononuclear cells in your ear slide, then you don't have an eardrum. Okay, it's just that simple. You'll have these large mononuclear cells, baby macrophages, and they've come through from the middle ear. They don't come from the skin in the ear canal, and they indicate otitis media. I think that's really important to know. You don't need to sedate that animal to examine for an eardrum. Forget it, you haven't got one. So you have to treat that ear canal possibly medically into the dog, and maybe flush with some saline, and treat it as if there is no tympanic membrane.
好，在这个部分呢，我们要讲的是一个比较重要的一个内容。如果我们在细胞学检查当中，然后在这个耳道采样了以后，发现有这个单核细胞，大家可以看到单核细胞是这样的一个很大的这样一个核也很大很圆的这样的一个细胞。那如果说是检查到它有这个单核细胞呢，说明这个狗一定是有中耳炎的，是有中耳感染的，而且它这个耳朵的这个骨膜肯定是受到破损的，就是说它在正常的这样的一个皮肤表层细胞里面是不会出现这样一个单核细胞，它一定是从里面就从其他的地方移行出来的。所以如果我们在这个细胞学检查的时候发现有这样一个单核细胞存在，那我们一定要立即去治疗这个狗狗的中耳炎，然后就需要去给它进行用这个生理盐水去进行冲洗啊，或者也加上一些其他的一些治疗的手段。
And the next slide. Okay, so ongoing in this presentation is just a list of questions to ask yourself. So initially it's just of course the order of priority will depend on the history, but and the physical examination and your cytology, but still here's the first two questions. Has that dog got sarcoptic mange, or has the dog got flea bite hypersensitivity? So there are ways of treating for those things, or doing treatment trials. Anyway, just straight to the next slide.
好，接下来呢就是一些问自己的一些问题，然后这些问题呢是会根据这个病史、体格检查、细胞学检查，会有一些不同的优先顺序。大多数呢，比如说这个 有没有疥螨的感染呐，然后有没有跳蚤的这个超敏反应症状，那这些都会有一些这个治疗的手段。
Next slide. So that was just the end of the flea one. Has this dog got a bacterial infection? Now there's a lot of information here about infection which you can look at at leisure, but it's important to realize there's 3 different kinds of pyoderma and we treat them all differently. So discerning between surface, superficial and deep pyoderma is important.
好，那这张幻灯片呢，就是结束了一下刚才说的我们这个跳蚤过敏的这一部分。然后第3个问题要问的是说，这个狗狗有没有这个细菌感染？然后关于细菌感染这个脓皮症这方面，这个地方有3种不同的类型，是非常重要，是需要大家要去进行区别去了解的，因为就是不同的这个脓皮症，它的治疗的手段是不一样的。
Next slide. So the next few slides actually help you to discern between the 3 different kinds of pyoderma, and there is some good information there on how you would treat those things. Most of the products and antimicrobials I think you have available, and I think that could just be a useful resource for you. But just to make it simple, surface pyoderma is just bugs around and over cells. Superficial pyoderma is where you start to get bacteria inside cells, and then you've got deep pyodermas where you've got infection in the deeper tissues. It's that simple, really. But they're all treated differently, and it's made quite clear on the next few slides as to how you would approach those. So maybe we just skip through those.
好，接下来这几张幻灯片呢，大家可以自己看一下这个上面的内容，然后这个表皮性的这个脓皮症，还有这个浅表脓皮症和这个深层脓皮症呢，我们在这个细胞学检查的时候其实是可以进行一定区分的。那这个表层的这个脓皮症，它这些病原体主要是在这个细胞的外面或者是这个周围这样的一个状态。在这个浅表脓皮症的时候，它这个里面会有一些这个细胞的里面会有一些病原微生物。那当然这个深层脓皮症的话，那就我们可以看到这些深层的这些组织和细胞出现这个细菌的感染。然后大家也可以看到这个我们幻灯片里面有很多的这些这个治疗的方法以及这个提示，然后很多的一些药物啊洗剂我们在国内都是有的，可以做参考。
Just skip through them. Superficial, there we go. So there's a picture of superficial bacterial pyoderma. It's where you get the classic papules, follicular papules and pustules, epidermal collarettes. And in that picture, you've also got erosion, hyperpigmentation, the lot.
好，那我们因为时间关系呢，我们就快讲一些。然后像刚才说的这个表层，然后这个说这个浅表性脓皮症，我们可以看到有一些这个红斑呐、丘疹，然后它会有一些这个毛囊性的一些丘疹和脓疱。那这个就是会有一些色素的沉着，还有这些侵蚀等等这个症状。
And the next one. And yeah, just skip through them. It's just superficial, keeps going. There's a lot of information. And then you've got your deep pyoderma, pyotraumatic folliculitis and furunculosis. They require systemic antibiotics, definitely, for quite some time, often. And if you've got a poor response, you need to be culturing.
好，我们刚才有说这个前表脓皮症、表层的脓皮症，哈，这个呢就是一个很典型的这个深层脓皮症。我们可以看到它这个涉及到的组织啊，这些细胞都是属于这种比较深层的这些地方。它的一个表现是一个脓创性的毛囊炎，然后这个结病。那这个深层脓皮症肯定是需要这个长期的使用这个全身抗生素来进行治疗的。那如果对于这个抗生素的这个治疗效果不太好的话，还需要进行细菌的培养和药品实验。这个是需要采样的。
Next slide. And the next question, has that dog got a yeast infection? Well, they're pretty easy to track down. Yeast are easy to see on cytology. So there is information on how to approach treatment for those, topical or systemic, depending on how severe.
好，接下来这个问题呢是说这个狗狗有没有酵母菌的感染？那我们这个酵母菌在这个细胞学检查的时候还是很明显就可以进行区分的。那这个幻灯片上也提供了怎么样去进行这个这个酵母菌感染的这样的一个信息。
And next slide. And do we need to assist that animal with treatment for itch? And so there's various ways of doing that. There's topicals and there are systemic treatments as well. So we can just skip to the next slide.
好，那接下来这个问题要问的就是说，它是不是需不需要进行这个抗瘙痒的治疗？那我们有可以这个局部用药，也可以全身用药。那我们也有这个幻灯片上也有信息。
And next slide. And so there's quite a bit of information about the different kinds of systemic therapy. And I've made a note there that non-steroidals have very little use in skin disease. And if you've got a stenotic, inflamed, infected ear, then steroids is definitely the way to go, systemic steroids. So that's just a little bit there about oral prednisone or prednisolone, still on the list, good for inflammation at the beginning of settling everything down, even if you're using other more modern biological antipyretics. Prednisone is still useful at the beginning for inflammation.
好，在这个关于全身用药的部分呢，老师有一个提示，就是说我们在这个皮肤病和耳部感染引起的炎症和瘙痒的这个过程中治疗的时候，非甾体抗炎药其实不是有特别多的益处，因为它们不能与这个糖皮质激素同时使用。如果是有这个耳朵疼痛的话，可以使用一些其他的药，比如说普热西痛啊，或者是这个加巴芬丁。那如果是说就是我们是需要进行这个激素治疗的话，那就是泼尼松龙这些其实是非常常见的，也是经常使用的这样的一个药物。所以就是因为考虑到很多的这些皮肤病是需要使用激素，所以就是非甾体抗炎药就是比较受限制。
And moving on, I think there's quite a bit more about antipyretic therapy there, so that will just be a resource, I would say. Epiquel, I think you have, oclacitinib. We are already using Loki Vetmab, which is Cytopoint, and I think that's coming for you guys soon, the injectable. So that's the next page, I think.
那我们这个全身抗瘙痒的治疗呢，有一些这个药物，比如说阿伯克它的这个成分是奥拉替尼，那就是还有一个可能最近有可能会上市的一个药叫赛托敏，或者叫做的Loki Vetmab，有可能过段时间就会出现，然后这个它是一个注射的一个药剂。
And just qualifying that antihistamines can be useful as part of a multimodal approach, they're never a monotherapy. They will not sort it on its own. Not very useful in cats and dogs.
然后在治疗这个犬猫瘙痒的过程中呢，这个抗组胺药物不是一个非常有作用的一个药物。就算要用的话，也不会说是单独用这个药来进行治疗。
And I think I've got one more important question. That's at the next page. Here we go. It's my favorite. Does this dog need an elimination diet trial? And the answer is just always yes. I don't care how you look at it, which way up. Just always yes. Okay, so there's pages of yeses here where if it's got ear infections under 12 months of age, if it's got allergic skin disease, if it's got recurrent gut signs, and because atopy is a diagnosis of exclusion, so you've got to have done an elimination diet trial to even say it's atopic. So, and I think there's even more pages of yeses, but please do an elimination diet trial. And I do know that you've got Royal Canin hypoallergenic, maybe not analergenic yet, but hypoallergenic still a goodie.
然后接下来有个问题要问的说，这个狗狗是不是要进行这个食物消除的实验？然后这个答案是的，不论是什么样的原因，这个我们都是要进行这个食物过敏。这个食物排查实验的比如说这个它异位性皮炎也好啊，还是说是它这个咬耳朵的这个感染也好啊，或者是这个过敏性皮炎呐，反复出现的胃肠道症状呐，等等等等，这些情况下都是要去进行这个食物排查实验的。那即使是说我们认为这个狗有可能会有异位性皮炎，那异位性皮炎它的诊断也是这个通过排除法来进行诊断的，所以我们一定要先排除它是这个食物过敏，然后再来确诊说它这个是异位性皮炎。所以就是我们是需要做这样的一个食物排查实验的。那我们在国内呢已经有这个皇家的这个低过敏原这样的一个处方粮，那我们是可以去进行使用的。那可能过段时间还会有更多的一些其他的这个无过敏原的这个处方粮，或者是其他的这些过敏原针对于过敏症状的一些处方粮，就是我们都是可以就是拿这些来进行食物排查实验的。
And I think we're just about done.
Oh.
Keep going on the yeses for elimination diet trials. There we go. Oh, that's the analergenic, but maybe that's coming for you. But that has a, I think the size in kilodaltons is almost like 1. It's really, really small, so dogs cannot react to it. Yeah. Next page. And it's just ask, is this the 10th time it's been seen? Where do you go from here? So if you've already done mite, flea and food rule outs, it's probably atopic. So you need to identify triggers, treat the itch, manage the barrier function, implement strategies to prevent recurrence. And we always encourage intradermal allergy testing for these guys. I don't know if that's something that's available to you or not. But
好，刚才说的这个处方粮呢，不管我们是不是有这个无过敏原，还是说是低过敏的这样的一个处方粮，就是狗狗对这个处方粮的这个过敏反应基本上是很小很小的，基本上没什么反应，所以大家可以拿这个来进行食物排查测试当然有其他的食物排查测试的方法，老师没有讲。然后这个还有最后一个问题要问自己的，就是说这个是不是同一类复发的第10次的就诊？那如果说我们已经排查了这个螨虫跳蚤、食物反应等等，那有可能是这个异位性皮炎。那治疗异位性皮炎的话，我们需要考虑到底是什么导致它诱发了这个异位性皮炎，要去治疗它的瘙痒，要去管理它的皮肤的屏障功能，然后要去采取一些措施来预防复发。那如果没有转诊的话，那需要考虑请主任去转诊。然后就是刚才有说了要治疗一些体外的寄生虫等等等等。在关于这个识别过敏源的时候，我们国内有些地方有可能是可以做这个皮内过敏反应源的这样的一个测试的。这个对于之后它 做这个免疫的特异性免疫性的这样的一个免疫调节的这样的一个治疗是很有帮助。那即使没有的话，那我们也有一些其他的一些药物来可以进行控制。比如说刚才提到的这个奥拉替尼啊等等这些糖皮质激素。
It might be towards the end. Oh, preventing recurrence. There you go. Yeah. Yeah, there's some suggestions there. The use of glucocorticoid sprays or lotions, quite a safe thing to do, and commonly used in humans for prevention of recurrence of atopic flares. We do encourage allergen-specific immunotherapy as part of the toolkit. We can skip that.
好，然后这个最后呢，就是可以用这个局部用药来做这个糖皮质激素的喷雾剂或者是乳液。就是当然最好还是要做这个过敏源来找到过敏源，然后来做这个特异性的这个过敏源的特异免疫疗法。不知道国内是不是已经有这样做？可能有的诊室有可能已经开始在做。但是不管怎么样，就是有一些其他的方法还是可以用的。
Next one.
I think that's the last one.
Yeah, wow.
Yeah. Oh, it's such a tricky thing. We want to hear it all, and we want to get the full package out of the webinar, but we have run over a little bit of time today. Please ask questions if you've been waiting and you've got questions about dermatology. Please send them in. Annie, I don't know if you want to announce that. And I haven't had my chat box open, so I haven't seen if there are any already.
好，然后我们刚才就是关于课程内容，已经时间都基本上就是刚才的内容。然后大家有问题的话，欢迎大家把这个大家的问题放到这个聊天框里面，我们可以再请老师再为我们解答。
We asking questions now, or we submitting questions?
Yes, please. Asking questions. Have you got some, Elaine?
Yeah. I was wondering whether you mentioned that with the food allergies, you need to do trials. Obviously, especially if there's dogs under 12 months.
Yes.
But if you see a 10-year-old dog with the same signalment, the same clinical signs, you'd still do a food trial, wouldn't you?
Yes, I would. Yes, it would be unlikely to be an atopic dog if it was a 10-year-old having its first skin episode. So your differentials there would jump straight to being food allergy and endocrine would be the top of my list in an older dog. Yeah, and quite often those ones have Dermatitis. Yeah.
I think often people do self-treatment at home and they manage for years. And some vets don't actually haven't actually done trials with their patients, so they put up with it for years. So by the time we see it, it's quite bad.
Yeah, but you can sometimes just be the magic bullet, instead of feeding that, you feed this and you fix it. Yeah.
Annie, can you translate my question?
Yes, I'll translate. 刚才依琳在问，就说这个我们老师刚才课程中有提到，就说小于这个12个月的这样的一个狗狗，它会做这个食物排查实验。那就是依琳她问说，假设说这个狗狗已经10岁了，然后它有同样的这样的一个症状，我们是不是还要做这个食物排查实验呢？然后这个厉老师回答说，是的。即使说它这个因为10岁的狗狗很有可能不是这个异位性皮炎，但是它如果说有这个皮肤的瘙痒的一些症状，它很有可能会这个食物过敏或者是这 个内分泌的这个问题。然后依琳刚才说，很多的这个主人有可能会自己就在家里面换一个食物，然后这个食物，然后那个食物换一下，然后有些时候狗狗可能就好一些。就是很多的一些兽医师有些时候可能会想不起来要做这个食物排查实验，所以就是会提醒大家，就是需要把这个食物排查实验做起来，就是这样。
There's some comments or questions in the chat box. I can't read them, so I don't know which they are.
Yes, there are some questions. So one question is from Dr. Ying. She says the yeast is very common on cytology on skin samples. So when doing the cytology, do we see the yeast and then when we need to deal with it right away? Is that what we should do, or is it something else?
I think any more than one yeast per high power field is abnormal. So it's unusual for it to be more. If you're seeing yeast at all, really, you've got to be suspicious, and if it's more than one per high power field, we consider that a problem.
然后老师的回答就是说，在一个高倍镜下看到有大于一个的这样的酵母菌病原的话，就是其实是一个不太常见的一个状态。就是说，如果说是看到有酵母菌，其实就是一个不正常的一个状态，就是需要怀疑它有没有这个酵母菌的感染。那特别是如果说是在一个高倍镜下发现有大于一个的病原，那肯定是需要进行考虑处理的。So the next question is about apple quail. Dr. Yu is asking, is it okay to use apple quail long-term in clinical cases, like 1 or 2 months? Is that okay? Is it safe to use that?
I was involved with first use of apiquel. New Zealand's a small country and we are used a bit like a guinea pig by Zoetis. So I've been very fortunate in having their antipyretic biologicals for years before they were released onto the American market. And so I personally have a study of 25 dogs that have been using it for more than 8 years. So it's not without problems, but fortunately the problems that have been coming up haven't happened with my particular cases, but there is issues with a higher incidence of urinary tract infections, a higher incidence of skin tumours. There is some evidence coming that if the dog has already got certain neoplasia, that it may make it worse. How do you know if the dog's got cancer or not? That's a difficult one. And how do you know what kind of neoplasia it's got? It's only certain neoplasias that it seems to affect. What else? Oh, it drops white blood cell counts in some dogs. We monitor that, and it's reversible. You take them off apiquel, it goes back up again. Interestingly enough, I will add that apiquel's now being used in a lot of other treatments. We're using it in a lot of immune-mediated and autoimmune diseases, and as adjuncts in some of the really unusual diseases like sebaceous retinitis, and so it has other uses too. But the long-term use, I'm up to years of it for some dogs, and for those particular dogs, it was life-saving in the beginning because they were so severe that steroids wasn't working, and they were heading for euthanasia, but their owners were offered the trials, and those dogs are still here. So in my own experience, long-term use hasn't been an issue, but you know, there are studies starting to surface where there are other problems. Weight gain is another issue. I'm just trying to think of them off the top of my head. But 2 months worth, not a problem. Not a problem.
Sorry to interrupt you, but can we quantify the risk a little bit? Like how many dogs are suffering side effects versus so many dogs who get a massively increased quality of life?
Very, very few.
Yeah.
Yeah, it's just because it's immunomodulatory and it works intracellular, we're not sure about everything that it does. So the studies that are published are only up to 600 days. So it's, yeah, we just don't know, you know, exactly what it's doing. The same with Cytopoint. We're starting to worry about the long-term effects of blocking interleukin-31 permanently in humans. It makes colon cancer worse. So what's it doing to dogs? We don't know. So we don't suggest using it more than 3 times a year, but that's a different story. Cytopoint's not there yet.
No, so Epiquel, just summing up for Annie before she translates, there definitely are some potential risks, but those are quite rare.
Yeah, and they're far less than long-term use of glucocorticoids.
Exactly, much safer than using prednisone. Sorry, Annie, that was really long. Would you like to summarize when you translate, please?
Thank you so much. I have been taking notes, so I think thank you very much. Yeah, I'll summarize though. 刚才在问这个阿波克的这样的一个药物，然后在新西兰呢，那个硕腾公司把他们这个国家就是做了很多的这个临床的一些药物的实验，然后就是其实就是没有发现就是总体来说呢，就是说它的确是会有一些这个潜在的一些因素的。那这些潜在的因素呢，比如说这个增大了这个尿道感染呐，或者说这个皮肤的肿瘤啊等等的。但是就是老师他个人有一些这个，也有至少有25只狗是这个长期使用的，有些狗是长达8年这样的一个使用。特别是一些狗狗最开始它因为这个症状很严重，它有可能都是要考虑要安乐的，最后还是因为用了阿波克以后，然后就是用这些泼利松农，用这些其他的激素是没有用，就用阿波克，然后就的确是改善了很多的这些这个症状。然后就是它总体来说是要比这个泼利松比这些激素是要安全很多的。然后即使是说它有一些这些这个风险，什么皮肤肿瘤啊，这肿瘤会这个瘙痒复发呀，然后这个尿道感染啊等等这些的这个复发的确是有这个风险。但是就是总体来说就是其实还是要更安全的。然后就是后面 Rebecca 老师在问说，那我们可不可以量化它的这个风险呢？就是说这个总体的病量出现风险的这些病例和这个总量的这个病例是大概是一个什么样的一个比例？然后就是老师说，他这个就是出现他个人就是经验当中出现这个有问题的这样一个病例，就是非常少的，就是他听说过有一些，他自己是没有遇到。然后就是因为他这个不管是阿波克也好啊，还是就我们刚才有说这个赛托米，它很多都是这个免疫调节的。现在出现的这些文献资料也好，这些研究也好，它只是研究到600天就没有再多研究了。所以就是我们的确很多也不知道会以什么样的一个情况，但是就是总体来说总结来说，刚才于医生说2个月可不可以用，是可以的。老师也有用过这个长达很多年的，然后就是说总体来说就是说的确是有一些风险，但是这个风险出现期的这个病例是比较少，然后呢它也比这个激素是要安全很多。所以就是刚才这个是一个讨论和总结的一个总结。
And I wonder if you don't mind me adding, Annie, to that, because I think it's quite relevant to how much we talk about our patients' welfare and quality of life in the program, because we talk a lot about pain as a problem, and we're all the trainers are so good at treating it, but itching is actually something that desperately affects quality of life, doesn't it, Lee? It's horrible. Those dogs that are itchy their whole lives, they're having a really miserable time. And so I think certainly for me, if I had a choice of using a medication that might have a small risk of side effects versus being free of that, and being able to be free of that itching, that there's a no-brainer. It's not a choice I would have to think about too much. Does that make sense, Annie?
Yes,
I think it's a welfare issue, being really, really itchy.
I think it's important.
Would you agree, Lee?
Apoquel's not for dogs under 12 months of age, and that's important. Okay. And because there was some problems there with infections getting away on them, a higher rate of sepsis, and it's not to be used really if you've got quite severe infection. If you've got severe pyoderma, don't reach for Apoquel. You'll find your antimicrobials will reduce the itch, within a few days. You're better off not using them then. Same as
so treat infection first, and treat infection and parasites first, and do your food trial.
好。然后关于刚才这个使用阿波克的这个，虽然说的确是有这个风险，但是就是我们一定要考虑这个动物的福利，然后还有考虑这个动物的生活的质量，这个是需要我们大家都要考虑的我们在这个过程当中，我们都强调很多这个关于疼痛的部分，我们很多的培训师也非常的注重对于这个疼痛的治疗。就是瘙痒呢，它虽然是不是疼痛，但是这个瘙痒其实对于这个生活质量对于它的这个动物福利来说也是很大的一个影响。所以就是说，即使说有可能会产生一些风险，但是对比说这个让这个动物瘙痒，让它这个生活质量很差这样的一个对比来说，那老师依然是会要考虑去使用这个减轻它瘙痒的这样一个药物的。所以就是对于老师来说，他觉得这个他不是会太多犹豫因为风险然后就不敢去用这样的一个药物。然后关于阿波克呢，有一个提醒，就是说小于12个月的这样的一个狗狗是不可以用的，它有可能会导致一些这个感染的风险。然后呢，如果说这个动物有严重的感染的话，那我们就要先要去治疗这个细菌感染，然后再去治疗它的再去治疗它的其他的一些症状有些时候用了抗生素以后，它的这个瘙痒就已经减轻了很多。所以就是先去考虑在严重这个感染的情况下，先去考虑使用先去治疗它，然后再去考虑它的这个使用阿波克或者其他的一些药物。就刚才我们有说这个 EIA 嘛，就说这个体外寄生虫先去治疗它，然后把这个感染的这部分处理了，然后它有没有过敏把它处理了，然后我们再就是顺着这样的一个思路就是提供给大家，然后做一个提醒。Yeah, so the third question is again about Apoquel, but I think we have answered that already. So he's asking how long should we use Apoquel? And then he says, why not use NSAID as mentioned? Maybe they didn't hear clearly. And then he says, why we flush the ear after 72 hours? I don't think we said that, right?
What was that? Sorry.
So there's another question is repeating. He said they are asking how long do we need to use Apoquel, and then they are asking why we do not suggest the use NSAID, and then he asked why we flush the ear canal in 72 hours. But I don't think we said anything about 72 hours.
Well, non-steroidals don't do anything for the ear canal. They just don't. If something's working, it's not the non-steroidal. They just don't help. We need prednisone to get the canal open. And I think Rebecca will back me up here, because I've stopped her from doing total ear canal ablations for the last 10 years because I fix them and she doesn't get them. to surgery anymore, because I get the canals open and I get in there with middle ear safe compounded treatments, and we're able to salvage them. But if it's calcified, that's a different story, but that's a chronic ear. Yeah, so non-steroidals just don't get that canal open. I'm sorry, they just seem to stay stenotic, even though it might reduce some soft tissue swelling. It doesn't get the canal open, and they're not much use, unfortunately. Yeah, so we have to, if animals are on non-steroidals for their degenerative joint disease or whatever, osteoarthritis, we have to give them a washout of 72 hours and then get them on some steroids. This is for the really severely infected, ears that need a lot of treatment. Otherwise, we don't take them off their non-steroidals for their degenerative joint disease, and we treat it topically. But it's just for those who require it.
Lee, may I ask a couple of questions? I used to tell the trainers that we used to be told that with atopy, sometimes you don't see any lesions on the skin, just pruritus. You mentioned the lecture just now that you see erythema with atopy.
Mm-hmm.
But is it possible that there's actually no lesions at the start?
No, it is definitely possible that there's no lesions. Yeah, they can just be itchy, just nibbling and licking, and you don't.
Yeah.
I mean, the erythema is just if you're seeing, visual manifestation of the inflammation. You can have it can be subclinical but still be itchy.
Yeah.
You're right.
Could it be? Could contact allergy show up as erythema as well, or is it
No,
papules?
it's always lesions. That's the difference.
Always.
Yeah.
Okay. Last question was, I'm a big fan of food trials. Been doing that for 10 years, even when people didn't believe me. I had reduced the ear infections by 80%.
Yeah.
In the clinic. But my question is that, do you know whether there's differences in different countries? Like in Australia, we believe that chicken, beef, and wheat are the top 3.
Right.
Do you know what do you know?
It does vary. Yeah.
Do you know what it is in China? Whether it's the same?
No, I'm
same
sorry.
Proteins?
I guess it depends what pets are fed mainly. There is some correlation between proteins fed in when they're under 6 weeks of age and the onset of adverse food reaction during their lifetime. It's fairly loose, but it sort of sets the immunology in motion. So it's all about what they're fed as a young dog.
I see.
So when they had that little bit of gut inflammation from a worm burden or a virus from mum or just any sort of tummy upset, that the hyperimmune state sensitized them to the proteins that were being introduced at the same time. So in New Zealand, most of our pet foods are chicken based now, but historically always beef and lamb, because we're a country where we grow lots of sheep and cattle. So beef and lamb are still at the top of my list, but chicken's number 3. So I imagine your pet foods are mainly chicken
mostly
too.
Chicken.
Right?
Yeah, mostly. Yeah, mostly
But
chicken.
not so much beef and lamb. That
Correct.
would be unusual. Yeah.
Probably. Can you translate, Annie?
Yes, thank you. I'll translate the previous one as well. 就是刚才有医生说为什么不用这个激素，然后就是在提到激素的这部分是说这个我们是需要对这个就是激素它对于这个耳部的感染引起的这个炎症和瘙痒是没有益处的。然后所以就是而且刚才有在说它因为是很多是需要用这个糖皮质激素而非载体抗炎药不能和激素同时使用。 所以就没有办法用这个非甾体。然后呢，就是说在这个耳道感染的这部分呢，我们是需要用这个激素来把这个软组织的这些炎症去给它控制下去的。那就是我们用这个非甾体去做这个耳道的这样的一个感染的治疗的时候哈，它没有办法把这个耳道给打开，这个是一个就是它的一个药物的一个特性。然后像是这个 Rebecca 老师，她也因为差不多有10年的时间没有办法做这个耳道切除或者类似这样的一个手术，很大的原因就是因为这个李老师把这个激素用上以后，他的这个耳道就打开了，所以就不用做这样的一个类似的手术了。然后当然说是这个非甾体，就是说如果说它有一些其他的一些症状，比如说它这个关节炎或者说有一些其他的这种疼痛的症状在用的话，那我们是分情况的，不是说是因为有了皮肤病所以就不能再用非甾体，不是这个意思，只是说它这个一个是药物特性，另外一个呢就是说它药物特性它没有办法把这个耳道打开，另外一方面它是因为我们要考虑用激素的问题。好，然后后来呢，依琳有问2个问题，一个问题是说这个异位性皮炎的这样的一个狗狗，有些时候在皮肤上可能早期的时候可能并没有任何的病灶的，这样是不是正确？然后老师说是的，那有些时候早期它的确在这个皮肤上没有病灶，因为课件里面写了它会有这个红斑这样的出现的，但是就是有一些病例它也是没有任何的这个病灶。然后另外一个问题依琳在问，就说它是这个关于食物排查实验，它是一个非常忠实的支持者，因为它在临床上有80%的狗狗，它用了这个食物排查实验以后，它的耳朵的这个感染耳道的这些症状基本上都会减少很多。他就问，就说是不是在这个不同的国家会有这个对于过敏源不同的这样的一个不同过敏源的这样的一个过敏反应，然后这个老师说是的确是有可能有这样出现的。那有的国家呢，比如说像是澳洲啊，然后这个新西兰，他们牛羊鸡肉这样的过敏的这个比例比较高一些。那我们国家我们目前中国是怎么样？那不同国家之间有可能是会有区别。那我们国家目前是怎么样？这个是需要有研究和这个流行病学的这样一个调查，然后我们之后可以考虑一下，可以找一找。然后至于为什么会出现这些过敏反应呢？很多的时候就是说这个狗狗小于6周的时候吃的一些一个蛋白质的这样一个来源，就有可能会导致它这个后面的这个出现这样发病。那很多的情况下呢，就是说比如说这个幼犬它在这个幼年的这个时期比如说从这个母源从母亲那里或者从其他的一些周围出现了一些这个导致它某一些东西导致它这个胃肠道里面出现一个比较高的这样一个敏感性，那之后就很有可能会有很高的几率出现这个过敏的症状。然后像是这个很多的这个狗狗是对鸡肉过敏、牛羊肉过敏，然后很多这些狗粮也是鸡肉做的，那就是我们国内可能要考虑观察一下，或者找一下有没有类似的研究可能有需要更多的研究来看到底是什么病源什么样的这个食物导致它这个过敏。
Excellent translation, Annie.
Impressive. I just suddenly realised when he was asking about the washout before, did he think I meant washing the ear?
Yes.
Yes. Washout means withdrawal of the drug. So you withdraw the non-steroidal for 3 days before you can start prednisone, because you can't give them both together. You've got to allow the non-steroidal to leave the system, otherwise we run into gastric ulceration. So I think that it wasn't washing the ear, it was wash out is withdrawal. I've just realized.
Okay. It might be because the translation I didn't quite understand. 就关于这个医生在问说为什么要冲洗要72小时，然后这个老师说就是不是说是要等72小时再去冲洗，而是说是这个如果说是已经是在口服着这个非甾体抗炎药，然后呢就是说我们又需要去用这个激素来治疗它的耳道狭窄这样的一个情况下，那不能是说停了药我们就立即就开始上另外一个药。就是老师他想表达的意思是说，就是说我们已经在用了这个非甾体的时候呢，我们停了药，要等72个小时以后，然后再去使用这个激素的这样的一个药物。 所以就是这个可能是因为这个理解的上，所以就是给大家造成了一个误会，就澄清一下。
Thank you.
大家还有其他的问题吗？
And is that another question, Annie, that's just popped into the chat box?
That was my comment.
Oh.
Oh.
In Chinese?
Amazing.
Yeah.
No.
Huh?
No, it can't be me then.
Oh, just in the Zoom chat. I think, have you put one in WeChat, Elaine?
WeChat, yeah.
Yeah. There's one more just popped into the Zoom chat, I think. No, Zoom chat. Not.
Oh, that wasn't me.
No, the comment was saying thank you, and then they were saying understood. Thank you.
Great. It was a good question to ask. That was a good catch. Yeah. On the washout. Yeah, that was good.
Yeah, good job, Lee. You picked that up.
Thank you.
Oh, so I think we're just about out of time. Just one point I wanted to pick up about when you'd said, Lee, about it being, you know, life-saving treatment in some cases, and it made me think that actually skin problems in animals are one of the biggest reasons for owners relinquishing pets, you know, giving them over to charities to look after. And so probably for the vets in our network who help and support animal protection organizations and rescues, this is really vital, and it's the first time we've ever, you know, had an expert in dermatology, so it's really, yeah, crucial work to the welfare work that our vets are doing as well. And I suppose
really pleased to hear that they've got Bravecto.
Yeah.
Because
yeah, they do.
That just simplifies. It's Flea, Dermatitis, and Dermatix just crossed out, just like that. Right.
Lee, can I ask last question from actually a Chinese student who's in Melbourne? With the food trials, when you're doing a food trial on a young dog, they're still growing, and allergenic is not available in China. It's not balanced.
No.
Hypoallergics.
Hypoallergenic is suitable for growth.
Yeah, it's not. The dog's still sensitive to that. If the dog has to go on a novel protein, how would you balance it?
You just have to, if they're still sensitive to hypoallergenic, then I would probably question whether the diagnosis is correct to start with, because what are we missing? You know, is it actually a severe atopic? Is it steroid responsive? Is it, you know, does Cytopoint work? You know, that would give you your answer that, it takes all the rest of the, you might have taken the pruitis away that's to do with the food, but you're left with the atopy that's kicking in at 6 to 8 to 10 months of age. And you give them Apoquel, can't do that till they're 12 months, but you know, we cheat and give them Cytopoint. And if it doesn't work for every dog, but if it does, then you go, okay, it's atopic as well, and we've got that in our basket. But hypoallergenic is a growth food, and
that's lucky.
Yeah, and it's unusual for, you know, it has got the right amount of calcium for a large breed growth formula, not quite enough calcium for a medium or small breed, but it's enough. So it's not a problem. I just use it till they're 12 months of age and manage pruritus and the secondary problems that come from that in different ways until 12 months, when I can throw them onto an allergenic and see if it's all about food.
Okay, thank you.
好，刚才老师还问了一下，关于这个食物测试的这样的一个问题。然后在这个食物测试，就是说这个幼年犬的时候呢， 我们在这个怎么用这个新型的这些蛋白质来进行这个平衡均衡饮食。那就是在老师在回答说，我们在这个用食物测试，如果说是发现这个狗狗还是有痒这样的话，那我们首先需要考虑它有没有这个诊断正确，有没有遗漏什么漏诊其他的一些病因病源。然后就是说，如果说这个食物测试，然后它还在痒，那有些时候可能会有这个异位性皮炎这样的一个情况出现。因为异位性皮炎很多它这个发病的时候也是这个幼年犬几个月的时候开始发病的。那有些时候我们在这个异位性皮炎的时候可以用这个 Cytology 就赛托米这些药物来进行控制。如果说没有的话，那可能就是考虑用这个低过敏原犬粮，就是皇家的这个低过敏的这样的一个处方粮去进行控制。那这个低过敏的这个处方粮呢，它是这个生长期也是可以进行使用的。然后它这个钙质对于大型犬的话还是比较高的，然后中小型的话可能不太够，但是就是也可以用其他方法来进行补钙。然后就是这个低过敏的话，到了12个月，然后如果说它还可以看一下它这个控制的情况。然后老师他如果说到了12个月，他会考虑给它放到这个无过敏原的这样的一个处方粮，然后去进行这个瘙痒的控制，然后看看它到底是不是因为食物过敏来进行这个瘙痒。然后之后呢，之前还提到有一个这个贝胃可，这个是一个驱虫药，然后这个是很多这个驱虫药是可以就是它现在国内是已经有卖的了，已经可以用，然后可以直接就是排除这个跳蚤，排除它的这个蠕形螨等等一些的瘙痒。然后就是这个是上一个问题的再上一个问题，也一起翻译一下。大家有没有问题吗？然后就是刚才听的有没有什么还有觉得不太明白清楚的，没有讲清楚的？
Oh,
Really
nice visitor. Yeah. Oh. So I think if there's no more questions, maybe that's that will bring us to the end of the webinar today. Is that right, Annie? I don't want to. I'll just do one final check.
好，大家如果没有什么其他问题的话，那我们可能今天的课程就要结束了啊。如果有的话，大家就可以积极的提出来；如果没有的话，那我们今天就差不多就到这里。大家不想打字也可以直接打开话筒说，可以。
Oh. I think we'll take that as we've made it. But yeah, huge thank you, Lee. It's been great to listen to all of this, and I'm sure we've all learned a lot. And thanks to everybody for their questions as well. Just to draw out more and more information. I'm sure this could end up being a day's workshop. At some point, it's hard to fit it in, but
like out on cats. With the exception to every rule.
Oh, and thanks, Annie. Your translation has been fantastic and just made this event possible. So thank you.
Thank you, Annie. Marvelous.
Oh,
thank you.
Thank you. Yeah, it's a pleasure.
Lovely.
Thank you very much, Lee.
然后谢谢大家提问。
Oh, that's nice.
Thank you very much.
Yeah, thanks for joining us.
Thank you very much, Lee.
It's great to see you.
Oh, thank you very much, Lee. It was very, very, very practical and informative, especially the Cytol.
It's my favorite. It's my happy place.
Oh.
Spend a lot of time with that microscope.
And so we'll just let you know that we've booked the date for the next webinar. It will be Sunday the 23rd of May at the same time, and we will go to our tutorial format where it's question and answer throughout, and the speaker will be Beck. Dr. Rebecca. So that, so I'll just I'll let you explain the topic and what questions you're expecting. And
Annie, would you like to translate Dawn first?
Yes, OK，那就是今天我们课程就在这里，然后呢，我们再占用大家几分钟时间说一下我们下一次的网课呢是关于这个问答的这样的一个部分，然后这个时间是5月23号下午，也是星期天同一个时间下午4点钟开始，然后是我们的这个 Rebecca 老师来给我们做问答课。
So it's actually been a really long time since I've talked to you guys, and I think this for a webinar, and I think this will be the first time ever that I've actually got to talk to you about surgery. Normally you make me talk about something else. Can you translate for me, Annie?
然后就是Rebecca 老师跟我们做问答课呢，就是他上一次给我们讲课那是很久很久以前了，那是去年的这个开始的时候我们在讲疼痛的。然后呢，就是因为Rebecca 老师之前给我们讲的好多都是讲其他的这个关于其他兽医的内容，然后这个下一次的问答课呢是他就是迄今以来第一次跟大家讲关于手术的这一部分，所以他很激动很开心。
So I'm very, very excited because I get to talk about my favourite subject, which is orthopedics. And I want to make sure that you all understand that the questions that I'd like to receive are not all just about surgery. This is a big subject. And not all of orthopedics is surgery. It's anything to do with the musculoskeletal system.
然后就是关于这个下一次的课呢，老师非常的激动，然后也非常的这个开心。然后关于这个他要讲的这部分呢，是关于骨科的这部分。然后希望大家所有人都能够明白也了解。那所有的这个骨科呢，不是所有的骨科病例都是关于手术的。啊，所有所有关于这个肌肉啊、骨骼系统啊这些都是可以考虑在这个骨科部分。所以就是希望大家多提问题，也不要只是局限于说手术怎么操作啊，很多的其他的病例也是可以问的。
So I'm really looking forward to hearing your questions. If you can start to post questions on our WeChat group, that would be great. Anything you like. I can talk for a long time on this subject. So I'm really looking forward to it, and I hope that we can keep the discussion at a level that's suitable for all the trainers. I know there's some trainers in the group who have a lot of knowledge and experience in orthopedics, but I don't want the others to feel that it's all going to be at that level. It can be a spread across everybody's knowledge.
然后呢，就是因为这个骨科的病例其实是涉及到很多不同的这样的一个内容，所以呢，就是大家可以积极的尽快在这个微信里面把大家的问题给它发出来。然后呢，就是我们希望我们下一次的这个讨论呢是能够让所有的兽医师都能够有受益的，因为就是有可能有的兽医师做了很多的骨科操作，很多的骨科的病例，很多的骨科手术，那有的可能就是只是看或者说只是有接触，但是就是我们希望我们的这个讨论下一次的问答课是能够让所有的这个不同的这样的一个兽医师都能获益，所以就是欢迎大家提各种各样的问题，然后我们可以把这个讨论就是做得丰富一些。
Okay, and so I think last thing to do is just to say a big thank you to Lee. I'm very grateful for your time, and this is a subject that has always baffled me. And so it's amazing to have you around to ask for help.
Here, take this.
Yeah.
It's good.
It's complex.
Can I just add, I haven't had to do any surgery for 15 years either because of this lady.
Yeah, it's a good division of skills.
Yeah.
So big thank you to Lee and also very much again to Annie for all your amazing translation.
Yep.
然后呢，就是最后要感谢这个丽老师，他贡献自己的时间，然后给我们讲了非常详尽的各种丰富的这样的一个知识。然后就是李老师说他也有10年的时间没有做手术了，因为这个皮肤科这些病例就是对他来说是非常激动人心的。当然也是欢迎也是感谢这个所有参与到翻译的这样的一个工作的人员。
And there's a lot of information too, as Lee referred to in the slides, for you to refer back to. So Dawn, I think you're going to send the PowerPoints through to everybody. Is that correct?
Yeah, it'll be Robbie, not me, but yes, we'll save them. We'll save them with the recording of this webinar so that you can access them at any time. Because yeah, that will be a really helpful reference. Yeah.
Absolutely. And if anybody has any other questions for Lee, feel free to send them to me and I can get an answer for you.
好，然后我们今天的课件呢，老师也放了非常多有用的信息，所以我们之后我们的 Robbie 会把这个课件发给大家，然后今天的课程也都是录像的啊，之后大家也可以回去继续看。然后如果大家还有什么其他的后来才想起来的问题，也欢迎发给我们的 Rebecca 老师，她也会帮我们就是问一下老师，然后把这个答案告诉大家。
Great.
Okay. I think we're done. We're done.
Yeah, we're done. So thanks everybody.
Yay. Thank you